Hi, I'm Dr. Sulata Shenoy, psychologist and director, Turning Point, Center for Psychological Assessments, Therapies and Counseling, Jayanagar, Bengaluru. Bipolar disorders are increasingly seen nowadays, and it is estimated that 1 in every 4 or 5 people may be suffering from mood disorders or bipolar disorders. In bipolar disorders, there is usually a swing, that is between extreme or elevated mood to the low or depressed mood, and this may take days, weeks or months, but usually it's a cycle that keeps repeating itself over and over, and that is why it is known as bipolar or two poles of the mood continuum. Now, most of the so-called depression or unipolar disorders, which were earlier thought to be only of one type, if examined closely, we could find symptoms of bipolar disorders which can very frequently get overlooked because they are mild. In frank or typical bipolar disorders, the person will have first a very elevated or a very high mood, very high on energy, be extremely restless, unable to sit in a place, do multitasking, multiplanning, but unable to continue with any one thing for long, talk excessively, do things which are rash and indiscretely, and have no sense of danger, may make very wild purchases or may go in for business ventures or financial enterprises which are very risky and will often lead to failures. And slowly this manic phase would slowly turn to depression. In the manic phase, I would like to emphasize that it's not only about elevated mood, the person may also become very irritable, angry, because the person is unable to carry out so many things that he wants, unable to sleep, unable to eat properly, may lead to weight loss, sleep deprivation, etc. In the depressed mood, slowly one may find that the person is increasingly becoming withdrawn to himself, unable to initiate any kind of social contact, very lethargic, very sluggish, very lazy, unable to even keep up his physical appearances or personal hygiene, and there is a total disintegration of personality. So, how do you know whether the person is having a depression or is it a bipolar mood disorder? You would do well to consult a professional who would be able to make a timeline. In this timeline, you will be able to see what are the high moods you've been having and what are the low moods you have been having. In many places, you would find that your high mood might have gone unrecognized because it is not so severe, but certainly there is a risk for you to get overly excited, overly impulsive and take rash decisions, and the next cycle you would be leading to depression. So, a professional psychologist, psychiatrist would be able to diagnose if you are having a mood disorder, depression or bipolar disorder, and these certainly can be treated nowadays with the kind of treatment and therapies that we have, but you must seek professional help for either of these.